Good morning, everyone. Thank you for attending July's webinar featuring FastFlow. FastFlow can be used anywhere in your hospital for both your clinical and administration needs. So basically, FastFlow can take any of those existing forms and workflows that you're doing on paper in your hospital, such as in your interoffice mail, and make it electronic. So for today's demonstration, I'll be covering and performing an overview of FastFlow, and then I'm going to go into a demo of the lab request workflow. So I will show you an example of our workflow submission, and then the Visual Workflow Designer tool, which is how I built out the route to route my workflow throughout the hospital. So with FastFlow, the first step to using FastFlow is the goal is to take those existing paper workflows that you're using in your hospital, make everything electronic, which allows you to accelerate the processes. You can capture data, run reports, dashboards, and metrics on the data that you're collecting, and then in the event that you do need a paper copy, you could always print it out later. But it's really nice that it allows you guys to add auditing and tracking with your existing workflows and also set up routes that are dynamic based on criteria that are being met in the particular workflow. And an example of that, it could be on a purchase requisition workflow, it could be a certain dollar threshold gets met, workflow would get routed to one particular person. With today's demonstration of a lab request workflow, maybe if a particular type of lab is requested, that it gets routed to a certain lab tech, et cetera, to perform that. So within FastFlow, the data that we're capturing, it's all discrete data, and we're writing that data to a SQL database. So that's really nice, and a lot of hospitals like that because, when you perform a workflow on paper, you're not able to generate those metrics and run reports based on the data that you're collecting. But since, when you're filling out the workflow electronically, everything is discrete, it's all being written into a SQL database, and it's really nice in that you can generate reports based on users, departments, the type of workflow, et cetera, to see what you're doing, how those requests are coming through in a timely manner, and also generate maybe metrics based on, how many particular workflows you're processing, items that you're purchasing, lab requests that are being made, et cetera. So with today's demonstration, the July monthly webinar is focusing on lab requests. And with the lab request workflow, when I start the workflow, I will log in as a physician in my FastFlow system, and I will create the initial request as that physician to request particular labs to be performed on my example patient. Now, the next step in the workflow, after the physician submits the request, the lab manager will receive the workflow. It will allow the lab manager to review that request, make sure everything checks out, and then they could choose a lab tech to route the workflow to that will actually be performing the lab work. So the lab tech would then receive the request. They would receive a notification in their email system that they have a new pending request. They could log into FastFlow, see the request from the physician for the relevant patient, all the lab work that needs to be completed. They could add their documentation to the workflow and then archive that request. And they could send the notification back to the physician to let them know that it's complete. They could also, archive it to a lab request group so that in the future, the lab manager or any of the lab techs, physicians, et cetera, can log into the system and see all the previously submitted workflows. So at this point, what I'm going to do, I'm going to switch over to the live demo and show you guys the process of how we built out this lab request workflow and allow you to see the process on submitting the request and routing it to the different parties. So with FastFlow, it is a web-based application. It is hosted on a server in your hospital, so it would be behind your corporate firewall. There is no access to it from the public internet for security reasons, but it's really nice that it allows your staff to be able to log into FastFlow using computers, workstations on wheels, tablet devices, any type of PC or tablet that would be on your hospital network would be able to access the application. So starting with this particular workflow, I logged in as my physician. to create the request for new lab work. So in the upper right-hand corner, you'll be able to see that I'm logged in as Patrick Brown, my physician at the hospital. And once I log into the system, I will see a list of my example workflows that I have access to perform that request. Now, I could search for particular workflows at the top here. I could also choose from my category dropdown. If I choose clinical, for example, it could bring up a list of all my clinical workflows, and I could choose the lab request form. To start that workflow, I would click on Start, and this will bring up the workflow that will allow the physician to begin entering the request. Now, you'll notice on this particular workflow that I have a field for the patient. We do have the option to query your clinical systems, your patient database, and pre-populate the information, or you could also type in the field and type the patient's name as well. So it's really nice, and hospitals really like this feature to be able to pre-populate the workflows with as much data as possible by querying multiple SQL databases. I'll type my name in as the patient. I could generate a case number here, 1234. What I will do is choose the patient location. So I could say that the patient is currently in room 201A. You'll notice with these radio buttons with the lab request being ordered, if I choose yes or no, it will automatically deselect the other option. So FastFlow is really nice in that you could validate your data and really restrict what type of data that you're capturing. So, you know, when you build out the forms in our form design software, you use radio buttons. You can make it an either or option where you could only choose one or the other, or with checkboxes, you could choose multiple options as well. Going to enter in the date. I'll say that the lab request was received at 11:09 a.m. And at this point, when I scroll down through my lab request forms, you can see I have different blood tests and other chemistry tests. And really, this is just my demonstration form where I could, you know, check different check boxes here. So I could come down here, for example, and choose a potassium test and maybe a cholesterol test as well. If I'd like, I could type in the ICD-9 or ICD-10 code next to the request as well. But what's really nice about this is, you know, with my example form, this is just one that I built out, but we could take any of the existing forms that you're currently using in your hospital and load it directly into our system so that it would be identical. You'll notice at the bottom of this form, I do have an area for the physician's signature along with the date and timestamp. So when I process this particular workflow as the physician, it will insert my digital signature onto that area before it gets passed along to the lab manager for review. So at this point, after I've selected my cholesterol and potassium tests, I will click on Save. We will validate the form just to see if there's any items that have been marked as required to make sure that they are filled out. I have my form here, and I could also see on my workflow in flight screen under my workflow actions what's required here. So as the physician, I still have to approve and sign the document before I send it over to the lab manager, but I also have an optional step where I could add lab request attachments. So if I need to include any type of supporting documentation, photographs, PDF files, et cetera, we could really upload any type of file that would be included with this lab request that would also be passed along to the lab manager and the lab tech. I'll click on Sign and Send. This will apply my digital signature to the workflow and route it over to the lab manager for review. Now, within FastFlow, I'm still logged in as my physician, Patrick Brown. If I click on my sent items, I'll be able to see that I made this lab request. And this is another feature that hospitals really like with electronic workflows, is that I could track these workflows. So I could see that I made my lab request. I could see that I created it on July 14th at 11:10 a.m. And I could see that the current location is the lab manager. And the last time they accessed the workflow will be updated as well. So they have not viewed it yet, but once the lab manager logs in, this date and timestamp will be updated with the latest timestamp. So it's really nice that as a physician or anyone else in the hospital, as I create different lab requests, I'll be able to track all those requests and see the ones that are in process. If I want to view my completed ones, I could always click on Archives and see the completed lab requests that were made as well with date and timestamps. All of these columns here are configurable, so depending on the information that you want to capture for your dashboards, I could have the patient column listed. I could have, you know, whether or not it was approved, which lab tech handled the request, et cetera, as well. So when we build out those dashboards in FastFlow, all of the data that we're collecting, you could choose to display it in the web application to make it really user-friendly and easy to view the data for all those particular workflows. So what I'm going to do now, I'm going to log in as my lab manager. So after Patrick submitted the request, the lab manager will receive an email just to let them know that they have a new pending request in FastFlow. They can log into the system, so I just logged in as Lisa. I can see that Lisa's name's in the upper right-hand corner here, and she is the lab manager. So once I log in, I'm taken to my inbox. I can see the lab request from my physician, Patrick Brown. When I click on that request, it will bring up the workflow with all the data that Patrick entered. I could highlight the workflow here and enlarge it to make it easier to read. If I need to make any changes or additions to the workflow, I could click on View Document, and this will bring up the same interface that Patrick used to fill out the workflow. One other feature that I have here, in addition to viewing the workflow here, if I need to reject the workflow, if I want to send it back to the physician for any reasons, maybe he typed in the wrong patient or wrong location of the patient, I can click on Reject, and that will allow me to choose the physician that completed this workflow and send it back to them along with the reason on why the workflow was rejected. So with a combination of using the reject icon and also required fields on the workflow, you can ensure that everything is completed and you have all the required information before the lab tech receives the form here. So as the lab manager, what I could do is approve this workflow. At this step, on the workflow and flight screen, my next step is to choose who I want to route it to. Now, I have this particular workflow built out to choose from my lab techs here. So I can come down here and choose lab tech 1, Lane Martin, or lab tech 2, Lauren, depending on who I want to send this request to. So after I complete the demonstration of the workflow, we'll go into the Visual Workflow Designer tool where I built out those routes to show you guys, the options that you have on building out the workflow routes. In this particular case, and I could choose Lauren and choose the next step. And what this will do is route the workflow over to Lauren. So Lauren will receive an email and allow her to log into the system to complete the workflow. Let me just log in as Lab Tech 2 real quick. So you'll notice that once I log in as Lauren, I'll see the lab request that was passed over to me from the lab manager. This will allow me to view the request. Again, if there's any mistakes or anything that needs to get sent back to the physician or to the lab manager, I could click on Reject. If everything looks good here, I could enter in any required documentation as well. You'll notice when I log in and scroll down, I could see that I have the digital signature from the physician when he signed it on July 14th at 11:11 a.m. at the bottom of the document here. But if everything looks good, I could perform this lab request. I could click on Approve, and this will add it into my archives so that in the future, the physician, the lab manager, the lab tech, or anyone else that you want to give access to will be able to click on their archives and see the requests that they've made and bring up those completed documents in the event that the patient asks for a printed copy, et cetera. So at this point, I'm going to log in as the administrator to the system to bring up the Workflow Designer tool here. And this is where I built out the routes on how I wanted my workflow to flow from the physician to the lab manager to the lab tech. Now, the Workflow Admin tool is available only to the administrators of the system. So the end users, such as the lab tech or the lab manager and the physicians, would not have access to this. But anyone that has access to manage the workflow will be able to modify the routes. Now, with my lab request route, you'll see that everything is drag and drop here. It's very easy to build out your routes. I'm starting with the initiator, who was the physician in this particular request. And I allowed the physician to add attachments, and I could tell by seeing the paperclip icon, along with adding their digital signature by reflecting the pen icon here. So under my options list, to add the attachments, the signature using a pin as well for some extra security or notes, all I would do is grab that option and drag it up to the step on where I want it to appear. So when I drop signature up here, this will allow the physician to sign the document. If I would like the lab manager to sign the document as well, I could grab signature, drag it up to lab manager, and you'll see that the little pen icon is displayed under the lab manager, and this will allow the lab manager to add their digital signature onto the document. Under my workflow steps, you notice that I started with the initiator step as the physician, and the first route is it's a role-based route, and it's going to the lab manager. So to set up this route, what I did is I chose the option to send the role, dragged it onto my workflow here, chose my department, and then also the particular role on who I wanted to route the workflow to. So I could scroll down here through my list of users in the hospital, I could choose the lab manager, and I could see that Lisa's currently in this position. Now, the benefit to role-based routing, it allows you to build out that route, and as employees join or leave your organization, maybe they're promoted, there's no need to update the route with, the new person that's currently the lab manager. So as the person is, maybe a new lab manager comes into the system, who's ever assigned to the lab manager role would automatically receive that workflow. You'll also notice that some of the other steps that we have for routing is routing based on prompt. And that's what I did for my lab techs option here. So when Lisa, the lab manager, chose from the drop-down list, I created a prompt-based route, which allowed Lisa to choose from a list of users that I specified on who she wants to be able to route the workflow to. So this is set up to, if I click on the options to edit it, you'll notice that it's set up to route based on a user group. Anyone that's currently assigned to the lab tech user group would appear in that drop-down list. So you can build out different user groups for lab requests or really any type of workflows and allow you to choose and prompt the different, initiator and different roles on who they want to who they want to route that particular workflow to. We also have the option to route to a group of users. So rather than prompting, what I could have done is just routed it to the entire group of lab requests and, lab techs. And as soon as the first lab tech logged into the system, they would be able to claim that particular request if they'd liked. So there's a few different options here, routing to departments, locations, and we could also perform these routes based on variables and different data being collected. So if I bring up the lab manager role again, you can see that I can link a particular route to a form field, and when I choose that option, I'll be able to see a list of all my fields on the form, and then depending on the field, if different check boxes are selected, etc. Here's a list of my tests that I want to perform. If the potassium checkbox is selected, I would route it to this particular user. Or I could do a reverse that if it's not selected, they would bypass this user as well. So this is really nice with the Visual Workflow Designer tool that when you're building out workflows, rather than remembering who a particular workflow has to get routed to, you would just build out the logic on the server, and then once you fill out the form, depending on the data that's being collected, the workflow would get routed to the correct parties automatically here. Now, finally, at the very bottom, you'll notice that I have my step actions, and this is what I want to do with all the data that I'm collecting. So again, the real benefit to using FastFlow is the ability to capture that discrete data and write it to a database so that you could generate those reports, metrics, and dashboards based on the data that you're collecting. So you'll notice that I gave myself the option to write this data to a database, and I did that by selecting database, dragging it up to my final disposition tab. I also could send email notifications, so maybe if I want to send an alert to the lab manager, once they receive a new request, it will send out an email alert to Lisa. I could export it as an image file here, so this is handy for archiving that completed request. As if it was done on paper, you would have it on an 8.5 by 11 digital TIFF image file, which allows you to print it out at any time if you do need a paper copy or if the patient asks for a copy of it. And I also chose the option to return to the sender, which is really sending an alert back to the physician to let them know that their lab request has been completed, so that they can log in, view any lab results if the lab tech entered anything on the workflow, and also it would be added to their archives as well. Now, we could also build out additional step actions here in FastFlow. These are some of the basic ones here, but as you build out different archives in the system, you could choose to write the lab request to different archive groups as well. So maybe as a lab manager, you would have the ability to view every lab request that came in, but as a physician, you would only see the lab request that you created rather than the lab request that other physicians created. So we could build out different archives and set up the permissions to those archives just to ensure that the correct people have access to the data and the workflows that they previously submitted. So at this time, what I'm going to do is I'm going to turn it back to Philip, and I can answer any questions that you may have in regards to the lab request workflow or FastFlow in general.
Okay, let's see. So far, we haven't gotten any questions. If you do have any questions, go ahead and submit them in either the chat panel or in the Q&A section to the right of your screen, and we'll get those answered. In the meantime, at the close of this webinar, you'll have an opportunity to request a demo. As you can see on your screen, you'll be able to request a demo. You'll also be able to view the most recent webinars and case studies. And just a quick reminder for everyone else, if you need to send this webinar to anyone, we'll be able to send you a recording once it's finalized, so you can feel free to send to your colleagues as needed. And just wait.
Right. Yes. Yeah, Philip, I just saw a couple questions come in.
Okay.
So one of the questions is, where is this information pulled from? So that's a very good question. It comes from a combination of different systems. So the actual form that I was working on myself is designed in our form design software from Formfast. Now what we could do is we could take your existing lab request form on paper and scan it directly into our system. So it's really nice that in Form Designer we could take that existing form that you're already using, that your hospital staff is familiar with, scan it directly into our system, and it would look identical, but just make it electronic. So anywhere that you currently write onto the form, you would be able to use checkboxes, fillable text fields, etc. Now, the patient information and the user information and things like that, that data would be coming from different databases at your hospital. So we could set up the workflows that when you start a new workflow, rather than going directly to the form, you could do a database lookup. So for example, you could search on a patient's last name, a patient's medical record number, etc., and it would return a list of patients that you have access to, and you would be able to select that patient and pre-populate the form with all of the patient demographics, such as maybe their name, medical record number, location, if you want to have a barcode on the form as well. Some of the other data, such as the physician's name when it was automatically inserted into the document, that could come from a user database table as well. Another question that came in are, let's see, how are the lab requests routed based on the role? So within the Visual Workflow Designer tool, the drag and drop interface where I set up the route from the physician to the lab manager to the lab tech, the role is really based on how the users are imported into the system. So FastFlow integrates with your hospital's Active Directory infrastructure. So what you would do is on the IT implementation side, we could import all of your users into the FastFlow system and build out the hierarchy for your hospital within FastFlow. So for example, with lab requests, you could have your lab manager, you could have your lab techs, you could have your lab manager's direct boss, along with all the physicians, etc. Then when you build out the workflow in the Visual Workflow Designer tool, you would choose the role-based routes or prompt based on a user group, etc. And those users that were imported from Active Directory would appear there and allow you to drag and drop and choose the different roles and the different routes that you want the workflow to take. Okay, another question is, how are role changes captured within FastFlow? So with a role change in FastFlow, I believe what I think this question means is if a person is promoted and maybe leaves the lab manager job, since when you build out the workflow routes, you would route the workflow to particular roles such as the lab manager and the lab tech, so that when the person changes, moves on to a different position or leaves the hospital, rather than rebuilding the route, you would just update the user on who's currently assigned into the lab manager role. So for example, if I had multiple workflows for lab requests and they all went from the physician to the lab manager, and if I receive, a new lab manager comes into the hospital, rather than updating every workflow, I would go into the user's database or the web interface for the user account management, and I would just update the user that's currently in the lab manager role. So for example, I could, update lab manager to be Philip rather than Lisa, and then all of my workflows would update automatically.
you have any more questions? You see any more come in?
Yes, one more follow-up to the role update. So is that a manual process? What we could do is we could set up our Active Directory system, our integration, to sync automatically with your Active Directory server. So that's part of the implementation process that we would work with your hospital to determine what is best. You could make it a manual process or, a manual sync, or you could set up a scheduled sync that maybe every 24 hours our system updates based on, your current Active Directory hierarchy, just to receive who's currently assigned into that role. So there's a few different ways that could be handled, but during the implementation, we would work with your IT organization. Part of it comes down to how Active Directory is set up and how the information would be passed to us. So one thing just to keep in mind is we could query different databases for patients and for employees, for user accounts, et cetera, but part of that requires us having access to it. So, during implementation, we would work with your IT group just to make sure that we have access to everything that we need access to. But if for some reason we are not able to get access into that, we would not be able to query those databases or update things automatically. So we'll work with IT just to make sure, and explain how the system works, but the hospital would also have to allow it on your IT side. I think that was the last question, Philip.
Okay. So that wraps up the question portion of the webinar. Like I mentioned, there will be a section at the close of this webinar for your questions and suggestions if you didn't get a chance to ask yours during this session. And with that, I would like to thank everyone again for attending and have a great rest of your day.